One thing I've been able to lead on in like my role as a CAP is setting up a psychological group within like our service. So I set up an emotional skills group based on like DBT principles and like teaching resident skills, like different skills to help cope with like emotion, help manage their distress and cope with like emotional like dysregulation and manage interpersonal difficulties, and as well as setting it up by sort of setting up a sort of structure with like regular review date and regular and sort of feedback from the residents afterwards helped it sort of continually improve and develop like as it goes along as like a rolling group offer.
I've also been able to lead on some group work, an online psychoeducational group for disordered eating, and this is sort of across 3 different boroughs, but because it's ran online, we can do that quite easily, and you know, touching on a range of topics like thinking styles or emotion regulation strategies, identity and body image. And I think here it's not only the idea that we're giving something new that kind of hasn't existed in this borough before, but also that we place a lot of emphasis on co-production and working collaboratively to design and facilitate and co-design, co-facilitate, co-produce these sessions together with experts by experience, kind of draw on their insight and knowledge and really channel in some of that sort of peer support. And I think that's a lovely piece of work that I've been able to lead on.
Yeah, and I suppose we've also had the opportunity to offer training to like other professionals. I think specifically within like the disordered eating pathway where I sit, about like raising awareness of like eating disorders and like delivering training to sort of senior practitioners and to like the community mental health staff about sort of early warning signs and like how they could seek support or like access our service, and how to sort of communicate and engage with people who are going through a disordered eating presentation.
And also the sort of primary care or non-psychological workforce too. So, for instance, delivering training to GPs around working with borderline personality disorder, which I think people can sometimes find it difficult to know how to manage ruptures in primary care settings, and really giving just some of that psychological knowledge and understanding and just sharing that with our colleagues and being available and ready to answer questions about it and learning from one another.